welcome back to my channel, Life with Elle. If you're new here, welcome. We're so glad you joined us all. And if you're returning, welcome back. Don't forget to like, comment, and subscribe. This is just a quick introduction to what will be a longer than normal video. I really hesitated and was kind of reticent about sharing this video or filming this next video, but I really believe that the subject matter is important. So I am gonna be gone for a bit. This will be probably my last video for maybe a month. Hopefully I can get back and do one again because I have a nice spring haul that I want to film for you all, but I'm having surgery on Thursday. And I wanted to share it with you, but it was just, social media can be very judgy, and I wasn't sure if it was too personal, what I wanted to share. But as you hear me say in the video that's going to follow this is, I thought, well, maybe it's off brand, I don't know. But my brand and me being true to myself is empowering women. So the topic of the video about my health journey is really true to my brand, to empower women with information and share. And yes, we love fashion, and yes, we love beauty and skincare and all of those things. But what is all of that without good health and wellness? So what's coming up next, while we love all those things, is a conversation with my OBGYN, Dr. Dominique Allen, and I asked her to sit down and have a conversation with me about my health journey and some of the things that other women may be experiencing. And she was gracious. She welcomed me into her home. We had a little bit of wine, and I hope you will watch all of it, and it'll spark conversations with you, your family, your girlfriends, your daughters, your sisters, and all of that. So with that said, let's raise a glass to health and wellness, and I will see you guys on the other side of surgery in about maybe a month. I'll try to get back sooner than that, but I'm going to try to take advantage of this downtime and take care of myself and let my family take care of me. And yeah, that's it. So leave me a comment below. You can send me some words of encouragement, a little prayer if you want to, and I will chat with you soon. Love you, dolls. Bye-bye. Hey, dolls. Welcome back to my channel, Life with Elle. If you're new here, don't forget to like, comment, and subscribe. We are in a different location today. I'm super excited. We are at my friend first, Dr. Dominique Allen, and my gynecologist. We're in her beautiful home. First, thank you for welcoming me into your home to do this. I know in the past we kind of do like the beauty, the fashion, the lifestyle. We've done a lot with the keto journey, but today we're going to do something about my health journey. So before we get started, again, Dr. Dominique, tell me a little bit about yourself, and also why I want to know why you chose OBGYN. I've never asked you that before.
So again, I'm Dominique Allen, and I'm a general OBGYN here in the community. I practice at GBMC, and I've been there for 26 years, and so I do 50% obstetrics and 50% gynecology, which is awesome. And because of that, that's the reason actually that I chose OBGYN, because it gives you this really lifespan. So basically I see women from the time that they hit 18 until the time that they choose not to have any more exams, and so I love that continuum. And so I've had patients who, I've seen through their first marriages, second marriages,
third maybe,
children, and it's a wonderful relationship that you have with your patients. So right. I love OB.
I never asked you that before. So Dr. Dom and I met through a mutual organization which we both belong to, and then several of us are your patients. So maybe 3 years ago, normal PAP time of the year, and Dr. Dom said, do you know you have fibroids? And I was like, I don't. And really, I don't think I had much concern about it, because I think the line I used was, they're not bothering me. And you were like, if they're not bothering you. And the typical symptoms are that would cause some concern maybe?
So bleeding or pain generally are this, if you're going to have symptoms with fibroids, those are the most common.
So I didn't have any of that. And what I said to Dr. Dom at the time was that I always thought that the urgency of our going to the bathroom was just something, I always said I had a little bladder, basically. But it appears that the fibroids have been pushing on my bladder. So fast forward, I will stop and say for a minute because I was nervous about sharing this publicly. It is private, and women are taught not to share things and don't talk about these things. And Dr. Dominique and I talked a little bit about, before we started filming, about our personal brand, and both of us believe in empowering women. And so this is not off-brand for either one of us to have this conversation. And I thought, well, let's just talk about it because it can empower women. And I shared Michelle Obama's podcast with you. If she can talk about her hormone replacement therapy, certainly we can too. So 3 years ago, no, let's go back. What are fibroids? Because not everybody's familiar, not everybody has them, and talk a little bit about what fibroids are.
Certainly. So they're smooth muscle tumors and typically benign. So the majority of the time they're very benign. They can be very small. So you can have ones that are small as like a pea. They can get incredibly large, to the size of like even an infant. And at that point, then they're causing, quite a bit of problems. But they typically, if they're going to be symptomatic, give you pain and or heavy periods. So that's how the majority of people present. The numbers suggest that we as women, 70% of us will be affected by them at some point in time in our life.
Okay, so we're going to do a little show and tell. And now that the film is working, the video is working, I'm going to hold this up so dolls can see it. And then Dr. Dominique, can you show us, give us a little anatomy lesson?
Absolutely.
Maybe.
So
we're going to
what
lean
we've got
in.
is, this is your normal uterus, this sort of pinkish part right here. And so fibroids, and these are, sort of pretty big size ones, can be anywhere. They can be in the muscle, which is right there. They can be sort of hanging off on a stalk, or they can just sort of lay right underneath sort of the skin of your uterus. They can also lay underneath, like sort of right there where your menstrual flow comes from. And so typically those are the ones that are associated with heavy periods, just because they happen to be where your menstrual blood flow is coming from.
Okay, so there's no two women normally have, the same symptoms, or they don't reside in the same area. So mine, I have quite a few, and they pretty much fill up just about all of my uterus, right?
Right, correct.
So if you think back at the time, there was little concern, right? And so what leads them, because what causes them to grow, I guess you would say?
Right. So we aren't 100% sure what causes them to grow, but hormones and just the normal hormones of being a woman, like your estrogen and progesterone and things of that sort, can cause them to grow. But just being a woman in of themselves, and they grow at different rates. And we used to believe that if they grew really fast, that was associated with sort of malignant transformation of them. But now we know that's not the case. There have been numerous studies that say they can grow slow, they can grow fast, and that is not a bad marker. But they definitely grow at different rates, and typically the more they grow, the more symptomatic you are.
Okay. So we also hear that African American women, other women of color have more incidence of fibroids. We don't know why necessarily.
No idea.
No rhyme or reason. So we won't get that answer, but we know it's there. So are there differences in age? Do you see younger women that get older? I'm a doll of a certain age, so we won't share all of that.
Right.
But, do you see it more as women get older and get menopausal?
So what happens is that they are typically there, but you may not know that they're there, because if they're small enough, you won't necessarily have any symptoms, or you won't even necessarily feel them on a pelvic exam. But once they get to a certain size, then a lot of times you can feel them, or you then become symptomatic as the patient and start to have some symptoms of them. But they'll start sort of, as we are younger, and then just get bigger. So you could have something that may have started out as a pea, so you wouldn't have been aware of it. And then by the time it becomes a grapefruit size or bigger, then all of a sudden you're like, oh, now I've got some symptoms with this.
So fast forward, we started this journey just about 3 years ago, and then we would have MRIs.
Right.
and there are different types of MRIs, right? So you want to talk a little bit, because I think I had like an ultrasound and then the vaginal MRI. So the difference, and why would a person need, why would a woman need to have the two different?
So depending on what you need, there needs to be some sort of imaging, and so that imaging just lets you know where they happen to be, how big they are, where they happen to be in relationship to the other structures in your body. Are they impinging on your bowel? Are they impinging on your bladder? And so that is the helpful part of things. You typically start out with an ultrasound, and then if you need more information about what they're doing, what they look like, you know, are they concerning in any way, then you might then order an MRI to add to that information.
Okay. So with my journey, they kept growing.
Right.
And one in particular is about the size of a grapefruit, which is,
good size.
You know, it's a good size. And we're itty bitties, right? And so luckily I don't have, because I've seen women really have distended stomachs and different things. So I don't have that, but it's filling up the whole area. So what changes from, so in full disclosure, I'm having surgery for them on this Thursday. So, you know, my question to you was, okay, I'm in your office and we have these fibroids, they're not bothering me. And then, you know, well, we'll do another MRI in 6 months, and maybe we should think about a fibroid surgeon. And then we go to the fibroid surgeon, and then the fibroid surgeon says, you need to go see a gynecological oncologist. So, dolls, when you hear the word oncologist, it does change, because you know, you've like, to use your line, my ticket has been called, oh my gosh, what is going to happen? And you were waiting because you knew I was going to call you any moment. But it is frightening. I've learned a lot that it doesn't have to be frightening, but it is frightening. So how does one, and again, not everybody's the same, but how does one go from, okay, we have fibroids, maybe we need to get them taken out. Now we need to see a gynecological oncologist, and things are different. And how do you define that? What does that mean?
Right.
Is it a cancer sentence? You know, because that's what you hear. Right. So maybe you can share a little bit about that.
Right. So fibroids in general, their malignant transition is 0.2%.
Okay.
So they're incredibly rare that they actually are cancerous. But what happens is that when you're deciding to treat fibroids that need to come out, you want to go for the approach that's the least invasive. So what I did for Lynn, in full disclosure, is to refer her to a minimally invasive surgeon first, because this particular minimally invasive surgeon can take out fibroids, you know, through small laparoscopes and use really tiny incisions and get her back to her busy lifestyle.
Yes.
But when that consultation happened, she said, I just want to be completely, absolutely, in an abundance of caution, be safe, and referred to an oncologist, just because now we're not premenopausal, right? So we're not talking about our 20-year-old self. We're not talking about our 30-year-old selves. We're talking about a more advanced self.
Seasoned self.
Our seasoned self.
Okay.
So that's where we get to an oncologist, and this is in an abundance of caution, because there have been procedures that have been done with these minimally invasive surgeries just sort of across America, where they found cancers where they didn't expect them. So nobody wants to be caught like that, even though the risk is very low.
So dolls know me, you know me, and when I went, I had an iPad full of questions, and so two of the questions were, why can't you biopsy them to tell me if it's malignant or not, or they are malignant or not? And is there some medication intervention that could break them down? So again, no two women are the same. So why not those two for me? Or who would that be more appropriate for?
So when you think about fibroids that need to be treated, and not every one of them does, but as soon as they do become symptomatic, so as soon as you start to get to the point where you're like, well, this is pressing on my bladder, or it's giving me pain, or it's giving me a lot of bleeding, then you have to say, okay, how do we handle these? Is it something that can be handled non-surgically because we need our uterus, and by need our uterus we mean to have babies. So once we get to the point where
we don't need our uterus,
we don't need it,
right?
Then we go, let's be definitive, because there's always a chance, you know, depending on what age group we happen to fall in, that they can recur. So you might say, okay, we're going to do some medication to shrink them down or decrease the symptoms, or we're going to do a procedure where you stop the blood flow to them, and that will shrink them if you need your uterus.
Right.
But when you don't need your uterus and you go, we just want this done one time, then we end up with surgery.
Okay. Well, I don't need mine, and you were clear. You
Right.
don't need yours.
Right.
So let's talk about then, you know, the decision to have surgery.
Right.
Because for me, it was like, that's not what was supposed to happen. It was
Right.
supposed to be this little, you know, but it seems heavier, weightier now. Now it's still supposed to be laparoscopic. So
Right.
maybe you can talk about, because back in the day, you know, they would cut you
Absolutely.
all across here. Young girls, young
Right. Oh,
women too,
absolutely.
and you know, you wouldn't show your tummy again,
Right.
and all of this. And now they still have that type of
Absolutely,
surgery,
100%.
but you know, I'm having what's called a laparoscopic hysterectomy,
Right.
and what I'm getting personal here, but I do think it's just tell them why it's important,
Right.
Dom. Tell them why this conversation is important. So
It's so important because so many of these issues affect so many of us, especially in the African American population. We are plagued by these things, and so we need to make sure we have the right providers who do what needs to be done, and that can be very minimal to nothing, or if we need something more aggressively done, we need to make sure that we're in the right area for that as well. So it's just critically key.
So what will the type of surgery I have look like?
Right.
This is for y'all, but it's for me
Right.
too.
So
To
what's
ease
really
them.
nice is, and so the way that I was trained was a traditional hysterectomy or traditional myomectomy, where you either remove, you know, the fibroids if you needed your uterus.
Myomectomy
Right.
is
removal of just the fibroids
Okay.
themselves. But again, that's for a group of women who only want to keep their uterus. If you don't need to keep that uterus, then we don't do that. We do a hysterectomy. So the way I was trained was a traditional incision across there. But what's happened over time is that we have converted over to these minimally invasive techniques where you have incisions that are this big. So if you've got an incision that's this big, why would you do this big giant incision
Right.
across your belly?
Right.
It's just not the right procedure.
right.
And so in fairness to your patients, then you should suggest that they do a minimally invasive procedure, which is what you're having done.
And so that is just too little.
So it can be 2 to 5.
2 to
but
5.
They are very small. So you're talking about, you know, a half an inch, which will probably have either glue or tape, so they don't even require any suture material, and it just dissolves. And
I love
then
it.
you can get back to your regular routine of life in 2 to 3 weeks, as opposed to if we do the full incision, that's about a 6-week recovery.
Okay. So if you're like me and didn't recognize that you had them because you didn't have some of the traditional symptoms, what are some of the conversations you should just be having with your OBGYN just to say, you know, because I didn't, you know, thankfully,
Right.
but, you know, but should you be asking certain questions about that, or?
So typically with fibroids, sort of the way that we react now is, now if you talk to your mother, your aunts, your grandmother, everybody had their uterus removed, and they can't even necessarily tell
Except
you why.
my mother, who hasn't had her uterus removed, who has never had a hot flash, and so we won't talk about her. We'll just love her, but put her over there.
Exactly.
But the rest of us, right?
who've had that situation, the idea is, if they're not bothering you, we typically don't bother them.
Right.
But at some point in time, if they start to bother you, then we have to think about what's the best way to get them out. And so, is that bother them because they're pressing on our bladder?
Right.
Bother them because, you know, they're pressing in the back where they make it difficult for you to have a bowel movement? Bothering you because they are making intercourse uncomfortable?
Right.
So at that point in time, you have to have a serious conversation.
So, myth or fact?
Okay.
The intersection of hormone replacement therapy, you know, and some type of hormone, and contributing to fibroids.
So, good question. So, in general,
Do we need show and
I
tell?
don't think so.
Okay,
I was
okay.
sort of thinking about that.
Okay.
So, in a postmenopausal, so somebody who's in menopause, so that they're taking hormones that could make them grow a little bit more, which would be totally normal, right? So, with the normal hormones premenopausally, they grow because they're being fed by that estrogen.
Right.
But once you hit menopause, their normal course is to either stay where they are or to shrink down. So if you're taking hormone replacement therapy, then they will continue potentially to grow. And so then we're not that up in arms if you're taking hormones, if they continue to grow a little bit, because we know they have a source that's making them bigger. If you're not taking hormones at all, that's when we get concerned if either you get new ones or your existing ones start to grow, because you're going, why are they getting bigger?
Right.
What's stimulating their growth?
But the trade-off to me
Right.
is if you're having hot flashes,
without a doubt,
and you're not sleeping,
Right.
and I'm gonna link the podcast that Michelle Obama and Dr. Sharon Malone, Eric Holder's wife, talk about all of the symptoms.
Oh, absolutely.
They called it, like, when teenagers are young and cranky as they're getting older in their puberty, they call it the unwind of that.
Right.
You know, which it is, because, you know, we're hot, we're not sleeping, and
Right.
So,
Right.
so the trade-off, you know.
Right, and you take the trade-off. If you can't
Right.
sleep, as busy women, as busy professionals, we can't be functional. So
Right.
you go, well, we're just going to take that. And again, usually that doesn't bother us.
So one of the things we didn't talk about, so when I saw Dr. Lou, she said, you need to have a conversation with Dr. Dominique about having the ovaries removed too.
Right.
I'm like, so real story, I called her from the hallway and said, please, can I come upstairs now? And you were like, get rid of all of it. And the one thing that I noticed in you, you know, we have a lighthearted relationship, but you were like, Lynn, if the ovaries are still producing hormones or something, if I'm saying this right, there could be a chance of something else happening, an ovarian cancer, and by the time you find it, it might be a little late.
So the issue with ovaries is that we, as physicians and as women, right, this is very disconcerting for me as a woman too, have no really great screening for ovarian cancer.
Okay.
Right? So if you're going in to do surgery and you don't need those ovaries anymore because now they've ceased to function at a certain time in our life, mine have ceased to function, yours are not functioning, then we should remove these things which could only cause badness, because the risk of ovarian cancer, though it is low, is not zero. And the problem with ovarian cancer is by the time we find it becomes a stage 3 cancer in most parts. So
and it's late.
It's just, it's a late cancer diagnosis, and you know, for the most part, people don't do well with that diagnosis.
So post surgery,
yes.
There is life post surgery. I'm
Absolutely,
assuming there is life post surgery.
A better life.
A better life
with a nice bladder that's not being tweaked.
And I did ask a flatter tummy, but you know, that costs a little bit extra apparently. So what are the expectations? So you've gone through the healing process and all of that. The hot flashes.
So the hot flashes will be the same because those ovaries that we have right now are really not working.
Right.
So only the hormone replacement therapy that we were taking prior to surgery were mimicking what the ovaries used to do.
Gotcha.
So just having them in the trash just means that we don't have to worry about them in the future.
So I'm going to go back to one other thing. So the surgery is also to remove them, but there's some pathology testing with that to make sure
that it's healthy.
So does that happen like immediately? Like how soon do you find out?
So within about 3 days. So what they do is they take that uterus, they take the ovaries, they take the tubes, and they dissect them. And over a period of about 3 days, you get nice, normal, healthy results back.
Of course, thank you. So final thoughts, something that you really want girls to know about, you know, what they should be thinking about, conversations with their doctors. And then we are going to come back post.
Okay.
We're going to come back post Dr. Dominique's going to go on vacation because we wanted to have some downtime. And we're going to come back, and I'm going to be fabulous after all of it.
Always
and healthy, right? And talk about it. But what would you want women to know about this conversation? Because it's like people don't want to talk about it.
Well, I think that people should talk about it, right? Because that talk is empowering. And then if you start talking about it with your family and friends, and you realize you're not alone, because you tend to think, oh, this is just happening to me. And then once you make that conversation, you're like, oh, it's out there.
Right.
And so that conversation can be so empowering. And then, you know, sort of the fear of surgery sort of captures everything.
Right.
But then after you realize, I was actually feeling a little bad, and now I feel so much better. Right? That weight that you've sort of gotten used to, you know, from that heaviness of that uterus over time, it's gone, and you're like, oh my God, I feel so much better. So not to be frightened.
No, right.
And just to be empowered.
I think our generation, like our moms and grandmothers, like, don't talk about it.
Absolutely.
But I did go to Mommy, who you know, and say I was going to do this. And she was like, you should do this. I thought she was going to be like, that's personal, don't talk about it. But she asked some of her girlfriends. So hopefully, this was helpful. You will see Dr. Dominique back. We're going to sip now. We are going to sip. Cheers. Thank you so much. I love you.
I love you back.
Bye, dolls. Talk to you soon.